We're now going to talk about progress notes, and these are something that should be completed every time that you see a patient or an encounter. So if your patient came in yesterday and you evaluated them for a right ankle sprain and they came back in today for treatment, this progress note should happen. And this is an abbreviated SOAP note, so don't think that you have to go back through and completely reassess everything. But depending on the injury and depending on where the patient is at, there is some reassessment that is necessary every day within the progress notes. We also need to note within this changes in pain limitation and patient comment. So how is the patient feeling? I talked about patient-centered care, so involving the patient within this. How are they liking the rehab? Or if you put them on crutches yesterday, are they able to get around today? Talk about more of the limitations. So maybe they've now been a little bit more exposed and are aware of what's around them and what is hurting them. And so we need to think about this as we write that progress note. So if we tried something day one and our coworker comes in day two, that they're not just trying again the exact same thing you said. Same as within the initial notes, you're going to want to put any treatments provided and reassess as needed. We also need to make sure that we are documenting the home exercise programs and that is progressing them toward their goals. So if you use specific programs that you can find online that you can create an exercise program, that needs to be included within the medical documentation. If it's something that you have written up and have different programs already saved, also that should be included, that what they did and why, so that way you're able to see it. We also want to think of some interventions for the next visit and assessment of goals. So I firmly believe that patient care needs to happen day to day or treatment to treatment or time that you see them. But I think it's also important to have an idea of how the patient should be progressing and what are some things that you could use at further times. This next thing that we're going to talk about, that all communication must be documented, and I think this is something very important. So we talked already about that HIPAA, FERPA, and high-tech governance, and so we need to make sure that we are communicating to our patients in proper ways. So if we are faxing, making sure that we have fax cover sheets and that patient information is just not being seen. That if we have email, that we have a tag at the bottom of our email that notes in case of a wrong email that this is private record, to please not share this. We also need to note that about text. So text is very important because some forms of texting are actually not patient protected, and iMessage is one of these. So making sure that we are not texting private information to our patients. There are applications that are available that you are able to digitally communicate, but any type of communication like this that does occur, and if a patient sends us a test, these all need to be saved within the medical documentation. Another important part is a canceled appointment. So this is a little bit harder if you just have walk-in treatments, but this is something to note, that if you tell your patient to come in the next day and they don't come in, that this needs to be noted that they missed an appointment. Let's say that you are seeing your patient 2 times a week and they came on Tuesday, but then mixed the next 2 treatments. So that would be next Thursday and next Tuesday. That looks like you did not see the patient for almost 2 weeks. And that appears wrong, but rather we know the patient canceled 2 appointments. And so those need to be written. So every time a patient canceled, just something as simple as the patient, called the office and noted that they would not be able to attend treatment today is appropriate. We also need to talk about changes in work or participation status. So anytime the patient is able to, let's say they are an athlete and they're able to participate in a little bit of the warm-up drills, that needs to be noted and used within the daily, within the progress notes for the patient. And the last one we're going to talk about is a discharge note, and this is absolutely important to have. If you have a patient who does not have a discharge note, it looks like abandonment of care. And so this should happen after the patient is better. Should be there for any time there's a re-injury. That should be a new SOAP note. And you must do as what's on the screen, as you can see, their status, signing, dating, and the reason for the discharge. I oftentimes, when I worked at the secondary school, would actually discharge patients in between seasons of sports. So commonly you'll have a patient who maybe plays basketball in the winter and then let's say softball in the spring. And so there's that gap of time that you don't see them maybe. And so I like to re-get a new evaluation and note the patient's status at that exact time.